BCC Practice Test 2026 Board Certified Chaplain Exam Questions and Certification Prep. Question 1. What does CPE stand for in the context of chaplaincy training? Certified Pastoral Education, Clinical Pastoral Education, Continuing Professional Ethics, Church Professional Evaluation. Clinical Pastoral Education is the primary training method for chaplains. Question 2. A primary goal of interfaith chaplaincy is to convert patients to the chaplain's faith, proselytize for a specific religion, provide spiritual care that respects the patient's own traditions, avoid all religious topics. Chaplains support diverse spiritual needs without imposing their own. Question 3. Which document outlines the ethical standards for board-certified chaplains? The Code of Professional Ethics, the Hospital Handbook, the Bible, the Medical Ethics Manual. The Common Code of Ethics is used by major certifying bodies. Question 4. The concept of active listening in chaplaincy involves waiting for your turn to speak, listening to the words and the underlying emotions, giving advice immediately, taking detailed notes during the prayer. Active listening is a core skill for providing emotional support. Question 5. In a healthcare setting, spiritual care is often distinguished from religious care because it is only for atheists, focuses on meaning and purpose, regardless of religious affiliation, requires a medical degree, is performed only by doctors. Spiritual care is broad and inclusive. Question 6. A chaplain's role in a goals of care conversation is often to provide medical advice, ensure the family follows hospital rules, help the patient and family align their values with medical decisions, sign the legal documents. Chaplains help navigate the intersection of values and treatment. Question 7. Compassion fatigue in chaplaincy refers to feeling too much joy, emotional exhaustion from prolonged exposure to others' trauma, a physical allergy to incense, boredom with hospital routine. Self-care is vital to prevent burnout and compassion fatigue. Question 8. What is moral distress in a clinical setting? When a person knows the right thing to do but is prevented from doing it. When a person forgets their morals. When a person is angry at a doctor. When a patient refuses food. Moral distress occurs when institutional or external factors block ethical action. Question 9. Which organization is a major certifying body for chaplains in North America? AMA, APC, Association of Professional Chaplains, ABA, Red Cross. APC and NACC are key certifying bodies. Question 10. The ministry of presence refers to giving many gifts, being physically and emotionally available to another person, conducting a formal service, writing a report. Presence itself is a therapeutic intervention. Question 11. In the context of the HIPAA privacy rule, a chaplain can share any information with anyone, must protect the confidentiality of patient health information, is exempt from all rules, cannot talk to the patient. Chaplains are covered entities or business associates bound by HIPAA. Question 12. A spiritual assessment tool commonly used by chaplains is FICA, faith, importance, community, address, stethoscope, X-ray, blood test. FICA is a widely used spiritual history tool. Question 13. When a chaplain facilitates a blessing of the hands, they are usually supporting patients only, the environment, healthcare staff, the hospital board. It is a ritual to honor and support the work of caregivers. Question 14. Grief is best described as a 5-step linear process, the multifaceted response to loss, a sign of mental illness, only occurring after a death. Grief is a complex and individual experience of loss. Question 15. A chaplain's response to a code blue is primarily to provide medical assistance, support the family and the staff emotionally, take photos, clean the room. Chaplains provide support during crises and deaths. Question 16. Verbatim reports in CPE are used to record every word in a hospital, reflect on and analyze a pastoral encounter, report staff misconduct, write a book. Verbatims are a tool for self-reflection and learning in CPE. Question 17. Cultural humility in chaplaincy means knowing everything about every culture, an ongoing process of self-reflection and critique regarding one's own biases, ignoring cultural differences, assuming everyone is the same. It involves a lifelong commitment to learning and self-evaluation. Question 18. The common qualifications and competencies, CQC, are for nurses, board certified chaplains, social workers, surgeons. They are the standards for BCC certification. Question 19. In hospice care, the interdisciplinary team IDT usually includes doctor, nurse, social worker, and chaplain. Just the doctor, only the family, a group of lawyers. The IDT provides holistic care at the end of life. Question 20. What is the significance of empathy versus sympathy in chaplaincy? Empathy is feeling with someone, sympathy is feeling for someone. They are the same. Sympathy is better. Empathy is only for doctors. Empathy involves entering into the other's experience.